Hi, I'm Philip.
And I'm Jack.
We're here on behalf of McGill, and we're happy to be presenting for the CSA Academic Challenge 2018. Our presentation is a case for the standardization of preservative-free ophthalmic drug delivery systems.
Now, we wanted to choose an issue with global significance, and for us that was keratoconjunctivitis sicca, or KCS, or as many of us know it, dry eye syndrome. And that's the most prevalent modern ocular disease worldwide, estimated to affect over 2.79 million American men by 2030. The first line of defense is always artificial tears, and these are the little lubricant eye drops that we can buy at the pharmacy. And if those don't work, we look at corticosteroids or prescription medications like clofidogrel or cyclosporin. The problem with these treatments is the preservative, which all too often is this very harmful substance called benzalkonium chloride, or BAC or BAK for short, and it's simply used to maintain sterility of KCS medication in multi-dose bottles. Preservative-free medication is available, but in more inconvenient single-use droppers. When we contacted pharmaceutical companies regarding their designs, they told us that there were no existing standards regarding bottle design, so we saw an unmet need and opportunity for standardization.
So here we can see our two traditional solutions. On the left we have the multi-dose droppers. Now these are the ones that contain the preservatives. And on the right we have the single-use droppers. These can be preservative-free, although can be often inconvenient to use. So our paper is the comparison of keratoconjunctivitis sicca treatment with benzalkonium chloride preserved topical ophthalmic artificial tears and corticosteroids versus their unpreserved forms. So our paper is a systematic literature review. We found relevant publications through sources such as Scopus and IEEE Explorer. All of our sources were verified for quality, relevancy, and credibility. We identified 18 studies that were relevant and fit the quality criteria. Among the studies, several studied dry eye through animal models, while the rest engaged in clinical trials. Elderly patients, 50 years and older, were the most common, and most studies had more women than men enrolled. Some studies included a range of diagnostic and analytical tests, while others focused on one facet of the syndrome. Studies generally featured high quality of work with low risk of bias or conflicts of interest.
Now I'm going to talk about a few of the criteria that we used in evaluating and comparing between the preserved and unpreserved forms. And these 7 criteria are listed here from top to bottom, in more patient comfort at the top and ocular health related at the bottom. The Ocular Surface Disease Index, or OSDI, is simply a questionnaire to judge the effect that dry eye has had on a patient's quality of life. The tear breakup time is a simple test, simply the time it takes for the tear film to destabilize due to often dryness or a lack of the oil film. The conjunctival and corneal staining are very common at the doctor's office when the doctor inserts a dye called fluorescein into your eye and then observes using the cobalt blue light under the slit lamp to see the damage caused by the rubbing from the dryness from the cornea against the eyelids. And the Schirmer test is a simple test using a piece of paper and insert it into the eye for a set amount of time, and then we measure the length of the paper that has been wetted by the tears as a measure of tear production. Goblet cells are cells which produce mucus, which is part of the tear film, and we find that a decrease in goblet cell density is proportional to a severity in dry eye patients. Cytotoxicity is simply the toxicity of a substance toward organisms or cells and can be measured in vitro or in vivo. Cytokines and interleukins are messenger molecules, which we find are overexpressed proportionately in KCS patients.
So our paper found that many innovative alternatives to preserve multi-dose bottles or single-use droppers exist, but currently are very rarely in use. Each of these solutions has few drawbacks and many benefits, and we believe that incorporating standards will bring these superior technologies to the mainstream.
I want to talk about a few of the solutions in our presentation, in our paper which we mentioned. And the first of these is the ABAC system by a company in France, and it's simply a squeeze bottle, the type we would see in the traditional multi-dose bottle. However, the tip has been modified to contain a 0.2 micrometer filter membrane, and this allows the fluid inside to exit without problem, but when you release the bottle and the pressure has to restabilize, air that comes in is filtered, and the microorganisms that cause contamination cannot pass through the filter, so it guarantees sterility for at least 3 to 6 months. Now, in the center and on the right, we have the Hilo technology by Candor Vision. It's from a German company called Ursa Farm. And the main difference with this bottle is the mechanism, which is a press mechanism, which you press using the thumb, and it's simply a matter of preference often for patients, which one they choose to use. Now, with the first, one of the questions is, are these bottles easy to use? The squeeze bottle might be difficult to handle for some people. And what the study on the ABAC bottle found was that almost all the patients were unanimous regarding the handliness of the ABAC bottle. It was for 96% of people easy to open, 96.5% easy to handle, and easy to get drops for 99.1%. For all these criteria, and in a general manner, patients preferred the new ABAC bottle in comparison with classical preserved multi-dose bottles. On the right, we have the Hilo technology, which was studied in a 1994 paper back when the technology was called the COMOD bottle. And the conclusion was that no COMOD bottle showed a microbiologically serious contamination. No patient showed an unusual healing process, which would have been typical for any infection, and the vast majority of patients managed the handling at home well, independent of sex or age. So those are both very effective systems. But the more common one that we'll see today is probably this one by Aptar Pharma. It's called the OSD system. And it's very similar to the ABAC system, except it also has a pressure-regulated valve at the entrance, which closes and opens depending on the pressure you apply, and just further protects the fluid inside.
So the implications of bringing this new technology to the mainstream are generally positive. We have millions in healthcare expenditures saved as patient health improved. We have improved patient comfort and health in the most prevalent ocular disease worldwide. And we also have improved sustainability as the single-use bottles will be used less. For some challenges, we might have some problems changing the habits of the consumers and the medical practitioners. There might be some problems retrofitting production lines to produce these newer, more complicated bottles. And we might have some problems for education, again, for the consumers and for the medical practitioners.
So in conclusion, we recommend the standardization of preservative-free multi-dose bottles for KCS medication. Benzalkonium chloride and similar preservatives like PQ1 present significant obstacles in the treatment of an already complex syndrome. Given that companies like Laboratoire Thea, Ursa Farm, and Aptar Pharma are already offering preservative-free solutions at insignificant cost premiums, other companies should naturally follow suit. We believe it's self-evident that standardization would play a key positive role in the evolution of KCS treatment implementation and push superior technologies like preservative-free multi-dose bottles like the ones we've just seen to the mainstream, especially since this technology has been available yet largely unused since at least 1994. Now that marks the formal end of our presentation for today, and I'd like to thank you for your attention, and I'd also like to thank all the anonymous reviewers who helped us craft and perfect this presentation. Finally, thank you for your consideration.